Hi, this is Ehren Trost, owner of Activecare Physical Therapy in Erie, Pennsylvania. I am responding to a couple questions from some patients or would-be patients that were concerned about lumbar stenosis and different options for treatment. And they were asking about dry needling specifically for back and hip pains. And there's a lot of nuances in there, so I'm going to attempt to break it down and hopefully this can help somebody. Obviously, it's not medical advice. I have not evaluated you fully, and therefore, these are just things to consider. Definitely, I would consult a qualified physician or physical therapist in your area. And if you're in my area, give us a call. So the question from Dennis is if we have severe central canal stenosis and bilateral foraminal stenosis, would dry needling help lower back pain and shocking pain down the leg and into the foot? And it looks like Betty also had a similar question. She's going for a nerve test for her hip, and she's wondering about dry needling as a treatment for her hip pain. So treating a x-ray or treating findings on an x-ray, which if we know that we have central canal stenosis and bilateral neural foraminal stenosis, there must have been some imaging done, I would assume, and a doctor has told you that you have those things on an x-ray. It is very different to have things on an x-ray and then actually have the symptoms from the things we're seeing on an x-ray or in an MRI. One of the problems that we have in healthcare is treating a diagnostic test and not treating a patient or the patient's symptoms. So as a physical therapist and one certified in the McKenzie Method since 2002, what you have to do is go through a mechanical assessment. And by moving the body in different directions repetitively, we can determine what structures within the body are actually causing pain, what symptoms are we able to change or modify by moving the spine. And with the knowledge of the mechanics therein, we can tell you what structures are actually involved with the pains that you're having. And in a large percentage of patients that have stenosis and such diagnosis from an x-ray or an MRI, they really may respond to some movements and stretches that really were unexpected in a good way. So just giving random treatments without doing a full mechanical assessment, I think is really dangerous, especially when you're dealing with nerve symptoms, especially down into the foot. If you do the wrong things, you can get drop foot, which can be a permanent loss of function of your foot, and that can lead to altered gait for the rest of your life. So it's very important that somebody really find out where is the nerve being pinched and how, and more importantly, what are the corrective exercises to take care of that. So, is dry needling a good idea for a patient like this? I'm a huge fan of dry needling. It is my treatment of choice for almost every other diagnosis and body part and condition, or at least in the top running for a lot of things, as long as there's no red flags to say otherwise. But when we're dealing with spinal problems, that you really need to nail down the mechanical understanding of what's happening, what's really at play, and not just what do the x-rays and MRIs say, because they're useful to corroborate what you're finding through your mechanical assessment, but they are definitely no replacement for that. So your physical therapist should be able to determine where things really are happening, where is the nerve really being pinched, and how do we deal with that. Dry needling, have I used it on lumbar stenosis patients? The easy answer is yes. Were they really stenosis sufferers, or in our assessment, did we find something else? Many times we're really dealing with a disc problem. And what happens with any of these conditions is that the muscles of the lumbar spine will try to stabilize the area. Muscles are slaves to the body's needs. So if the spine is unstable or having problems, the body senses that, and it recruits the muscles to tighten up and try to stop you from moving the areas until it is healed up. Oftentimes, because of life, work, we just keep doing what we have to do, and things get worse, muscles get tighter, and then the muscles themselves can seem to become a problem. In that instance, yes, dry needling is useful for resolving muscle tightness and spasm. However, it is not going to solve stenosis. It is likely not going to help the nerve pain down the foot. And if we're having a nerve type symptom into the hip, really anywhere from the lumbar spine all the way to the foot, we have to figure out, again, where is that nerve being pinched? Most likely lumbar spine. There can be entrapments and other nerve problems down the line, but they're less common and less likely. So I hope that answers the questions for Dennis and Betty, and please let me know if anybody else has other questions. Glad to help.